Thank you, Devin. And are you one of those people who take all of your medication at the same time? Well, if so, you may be taking some of them incorrectly. And here to tell us more about the proper administration and storage of your medications is Nurse Christina Paris. Thanks for joining me this morning.
Yeah, good morning. Great to be here.
I'm glad you could make it on in through the fog that Devin was talking about this morning. You know, always a pleasant time to see you bright and early on a Tuesday.
Yeah.
So let's dive right into medications. So when should we be taking our medications?
Yes, so it is really important to know how to take particular medications. Some of them have to be taken on empty stomachs. Some of them have to be taken with food. Some of them, when you take them, you have to sit upright for a certain particular amount of time. And then you also have to look at the drug-to-drug interactions or medication interactions. And then consistency. So some medications, it's really important that you take it at the same time every day.
Okay, so some it's important to take at the same time every day, but what about just generally, can we take all of our drugs at the same time?
No.
I feel like that's a bad idea.
So, right, so basically the answer is no.
Okay.
So some medications I knew about, like omeprazole, that's for acid reflux. Really any of those acid reflux medications you should take on an empty stomach. And because they work more effectively at preventing acid production if they're taken without food and things in your stomach. So that kind of makes sense. So they say about 30 to 60 minutes before meals. Also, I knew that medications like thyroid medications like levothyroxine should also be taken on an empty stomach. And you want to avoid taking calcium, iron, or other certain supplements within 4 hours. So you don't want to take your levothyroxine if you're also taking calcium or iron or different medications like that. And then osteoporosis medications, those are the biphosphonates. So those medications, you have to sit upright to avoid damaging your esophagus if those things come back up. Yep, and then of course, and then antibiotics. This one shocked me. I really was surprised. Actually, what I read said that you should take it on an empty stomach. So many of us take it with food because they irritate the stomach. I'm not saying if you do have a real problem with GI issues, then please talk to your doctor about when to take these medications. Will it hurt you? No. It just can reduce the absorption of the medication if you take it with food, the antibiotics. And then lastly, the other one that surprised me was iron. Iron supplements you're supposed to take without food, and 1 to 2 hours after, so 1 hour before meals or 2 hours after meals, and take it with water or citrus juice, like orange juice. I did not know that. And you, of course, want to avoid dairy, calcium, and acids within 2 hours. And so if you're taking your calcium and your iron tablets at the same time, it could affect the absorption rates.
Interesting. So there is a lot to be on the lookout for.
There is.
It would be good probably to talk to your doctor, getting a game plan of all of the different things that you need to be taking and when you should be taking them.
And a lot of clinics now have pharmacists that are right there in the clinics. Our pharmacists are doctors. They have their PhD. So they're very knowledgeable. I know sometimes when I bring that up to patients, they think, oh, what does a pharmacist know? They know a lot. Like, they're the ones that the doctors go to. So do ask questions. They can be a great resource as well.
Absolutely. And speaking of, getting all of these drugs and sort of organizing them, is there a good way to store them?
Yes, so that is really important too, things to keep in mind. When you're storing medications, you want to store them, well, first you want to follow label instructions. That'll tell you how to take the medication, how to store it. And room temperature, so room temperature is usually between 68 and 77. You want to keep them away. You want to keep them in cool, dry places away from heat and moisture and sunlight. So you really want to avoid bathrooms and kitchens due to their humidity and temperature fluctuations. And we all keep them in the bathroom.
Yeah.
Or kitchen. Actually, those are the big two.
Those are the two.
You also want to keep them in their original containers, tightly sealed with child-resistant caps. That's kind of for contamination, but also to keep the integrity of the medications. And then avoid extreme conditions. Some people will keep them in the glove compartment of their car, like say nitroglycerin or EpiPens. That can deteriorate or lessen the effectiveness of those medications. So you want to keep them because our cars, especially here in Wisconsin, where we can get really hot in the summer and then, minus 20 in the winter.
Yeah.
So those temperature changes are really not good. Monitor for any changes, look for color, texture, odor changes, and then keeping your pills organized. Make sure, some people use those pill organizers, which are great, but you want to be careful because if they're kept in those long term, say you travel with them or you put them in these, it can actually, if they expire or their conditioning, they can break down and not be as effective. So you want to be careful with that too.
That is certainly good to be aware of. Well, thanks for walking us through, there's a lot to know about and how to do it right and, get the most out of your medication.
And exactly, that's really it. If you're gonna take these medications, you want them to be effective, but you also can't spend your whole day taking one medication, waiting 2 hours, taking two. But have those conversations with your doctors or with your pharmacist and they can help you out.
Absolutely. Well, thanks so much for taking the time this morning. All right, we'll be right back after this commercial break for your morning What's Trending.